Thank you for listening to today's episode of Medical Device Global Market Access by Pure Global. Today we're discussing a critical challenge for innovative in vitro diagnostics, or IVDs. What post-market data truly persuades payers to grant and maintain favorable coverage and pricing? Securing initial market access is one thing. Defending your IVD's value year after year in competitive markets like the United States and the European Union is another. It requires a strategic and continuous collection of post-market data. In the United States, the primary audience is the private insurer, and their language is economics. While clinical data is the foundation, U.S. payers are most persuaded by robust health economics and outcomes research, or HEOR. They want to see real-world evidence that demonstrates your IVD's direct impact on their bottom line. The most powerful data answers questions like, does this diagnostic reduce hospitalizations? Does it help avoid more costly interventions? Does it streamline patient management to lower overall treatment costs? Evidence derived from U.S.-based electronic health records and insurance claims data is particularly compelling because it reflects the local patient journey and cost structure. A budget impact model isn't just a supplemental document. It's a central part of the value proposition. Across the Atlantic, the European landscape is more fragmented, with national or regional health technology assessment, or HTA, bodies acting as the gatekeepers. Here, while cost-effectiveness is crucial, the emphasis often starts with demonstrating superior clinical utility over the existing standard of care. A key driver for this is the EU's In-Vitro Diagnostic Regulation, or IVDR, which has been applicable since May 26, 2022. The IVDR mandates stringent post-market performance follow-up, or PMPF, forcing manufacturers to generate the very data that HTA bodies want to see. For these EU payers, well-designed registry studies are exceptionally persuasive. Registries that track long-term patient outcomes, and especially those incorporating patient-reported outcomes, provide a longitudinal view of the IVD's real-world benefit. Comparative effectiveness data, showing how your IVD performs against a direct competitor or standard of care in a typical clinical setting, is the gold standard. While a pan-European registry is a powerful asset, data from respected national registries in key markets like Germany or France can also be highly influential. In essence, while both markets are moving toward a reliance on continuous real-world evidence, the emphasis differs. The US leans heavily on direct economic and budget impact, while the EU prioritizes comparative clinical effectiveness as a prerequisite for the economic discussion. For IVD manufacturers, this means a post-market data strategy cannot be an afterthought. It must be planned well before launch, integrated into the product lifecycle, and tailored to the specific demands of each target market. If your organization needs help developing a persuasive post-market data strategy for global markets, we invite you to see how Pure Global can help. Visit us at pureglobal.com. Thanks for listening, and we'll see you next time.